Hello and welcome to episode 5 of VetPhysioLife. I am Shailen Jasani and I'm joined once again by Kim Sheeder. Hi Kim.
Hello, how are you?
I'm good, thank you. So Kim, the last time we spoke was a few days ago, actually, the end of last week, and I know that at that time you were both under the weather and having some car trouble. So I just wondered how you're getting on.
Well, I'm still under the weather and I'm still having car troubles, but I'm doing okay. I did some test drives yesterday of a few cars, so hopefully I'll get something decided by the weekend. And I'm still coughing well, so you have to bear with me, but I'm all right.
And I know the answer to this question already because it's almost guaranteed, but you're still seeing cases, are you?
Oh, yes, absolutely. Yeah.
Fair enough. So I guess what I thought we'd do is just catch up a little bit on the cases you've had this week, and then I also have a question from a colleague that they wanted me to ask you about. So I guess one of the things is that you probably have a lot of clients that you see regularly, and then maybe from time to time a new one that sort of drops in. Is that about right?
Yeah, that's exactly right. I've got some clients I see every single week, and then I've got some other regular clients that I see on maybe a 3-weekly or a monthly or even a 6-weekly basis. And then I've got sort of extras that come in and off, which are usually recoveries post surgeries of some sort, usually, or an acute soft tissue injury that will heal and go away again. So yeah, that's probably a very good description of my caseload. Yeah.
And so what has this been? God, I can't even speak. What has this week been like?
So mainly just regular clients this week. I did see this morning, I've seen a regular client, but one who I only see every 3 weeks. Interestingly, it's a Clumber Spaniel that has elbow dysplasia and arthritis because of that. And she's been doing so well with I find in summer that a lot of the arthritic patients do a lot better with the warmer weather. And she's been doing so well, so we decided we'd risk it and we'd push it to 4 weeks. And she's not been doing so well. So I spent a lot of time getting lots of knots out of muscles today. And I think she was pretty grateful afterwards because I got licked from head to toe pretty much after the treatment.
And so is she having ongoing care at home as well? Or?
Yeah, she has things like heat packs and sort of regular paced exercise and things like that at home. I have shown some strengthening exercises to do, but she's not the most compliant when it comes to doing exercises. She likes to do her own things. So what we try and do is include sort of hill walking and things like that to try and get her doing exercise without her realising she's not just having fun on her walks, basically.
So a little bit of trickery.
Yes, absolutely.
And what was I going to ask you? So how long have you been treating her for?
Oh, probably about 2 or 3 years now. Quite a long time, but sort of monthly, 3-weekly appointments, depending on how she's doing, basically, throughout the year. I also use laser with her, which she's really responded to really, really well, because we didn't do that for a long time. But since I got the laser, I started using it with her, and she really has perked up since then.
Fantastic. And these knots in muscles.
Yeah.
Can you just explain a little bit what a muscle knot is, and how do you know that there is one?
So the technical term is a trigger point.
Okay.
But it is basically like a little cramp or a knot in the muscle. So there are areas within muscles, whether that be human or cat or dog or horse or anything else, that have more stresses going through them usually. They're either a part of the muscle that has more force going through it when it's being used, or it could be where excuse me, sorry, I'm trying not to cough. Or it could be where two muscles pass over each other or something like this. But there seems to be specific places within certain muscles that if they're having to work harder than they really can cope with, they get tight and knotted. So in humans, the typical place is at the top of your shoulders, which you feel fine most of the time, but then if you go and have a massage or someone happens to dig their thumb into your shoulder, you can go, oh my God. And it's that sort of thing. So what really happens is that muscle fibres are contractile, so they contract and they relax. And what happens in the places where they're knotted is that the muscle fibres contract, but they don't relax fully. So what I come along and do is treat those, and they literally do feel either like a taut band or a little round hard lump compared to the rest of the muscle. So I treat those to get rid of them and allow the muscle fibres to relax back out, and then the muscles can be used as effectively as possible. But we kind of have to accept that in some cases, like with something like a joint arthritis, that they're likely to come back again because I'm not fixing the problem. I'm not doing anything to the bones. I'm doing something to the muscles that are supporting the bones. So that's the secondary problem of a primary complication. So it's likely that secondary complication is going to come back again. But physio can keep on top of it and keep them comfortable and working and moving as well as possible for as long as possible.
Yeah, that makes sense. And so two questions. One is, how do the dogs tend to respond when you press on these knots and help to relieve them?
Surprisingly well, I have to say, because if anyone's ever had physio for trigger points, they'll know that it's not a comfortable thing to have done to you. Initially, the first sort of treatments, they can be a bit wary and sort of go look round at you and maybe try and pull away and things like this. But they seem to realise that they feel a lot better afterwards, because I usually then, in subsequent treatments, will get greeted like I'm the best thing they've ever seen, and which is always lovely. And they will tolerate it. They will turn around and look at me and let me know that, that really hurts, that bit that you've just shoved your thumb in. But that's usually as much as they will do. They'll usually just go, okay, I can cope with this is fine, and then sort of allow me to do it. So, yeah, surprisingly well, I think, is probably the answer to that question.
Cool. And can you teach pet carers to identify knots in muscles?
You can to a certain extent. It takes a lot of practice. So what I tend to do is, rather than getting them to find specific knots, I just show them the areas that I know that those knots are going to accumulate in, and get them just massaging that whole area. Because it's going to do them probably as much good. But I've spent 17 years teaching my fingers how to feel these things, and it really does. I mean, when I first started, it was all just squishy stuff, and it takes a long, long time to actually be able to differentiate between what is a trigger point, what is normal muscle, understanding the difference in tone, understanding it's a little bit more impressive than just massaging soft stuff. So but yeah, with general massage in the areas that I know where the trigger points are going to accumulate, and with things like heat packs and stretches, then the owners in the meantime, in between my treatment sessions, can do as much as they can do to help their pets. Yeah.
Excellent. One day we're going to compile a Kim Sheeder's dictionary of physiotherapy terms with things like squishy stuff and jammed donuts. I love it. It's also brilliant. Kim, so that's really cool, because we don't plan these calls, so I never really know where we're going to go with them, but I always end up learning something. On the subject of planning, though, I did have one pre-planted question that one of our veterinary colleagues had asked, and I said I would run by you. So her name is Lara, and she's a real supporter of me and the Ralph NPRS and kind of all the things we do. So first of all, thanks, Lara, very much for all your support. So Kim, Lara was having a discussion with an orthopedic person, about how soon after a dog has had TTA surgery would you generally recommend starting physio. And so what I thought was, could you just explain basically what TTA surgery is for, and then go on to answer Laura's question? That would be great.
So a TTA is I can't remember the full name of it at this moment in time. It's a transtibial something or other. I can't remember what the A stands for. But it is for cranial cruciate ligament rupture. So it's one of the multiple surgery options that you can have. And essentially what it does is slightly change the surface of the tibia to try and help prevent that slippage of the femur, the thigh bone, on the tibia, the shin bone, which would normally be prevented by the cranial cruciate ligament. And if the ligament has ruptured, then they need to find a different way of preventing that instability. So the thing with the TTA is that they have to break the bone of the tibia, which is the shin bone, but they break it in a place that is very close to where the patella, so the kneecap, attaches via a ligament. So whereas something like a TPLO, I would say you need to get involved immediately, first day post-op. With a TTA, I would get involved first day post-op, but with a lot less enthusiastic exercises potentially. What I think, or really the only things I would be doing first day post-op after a TTA would be things to help with swelling and pain. And then I'd probably leave them quite quiet for the first couple of weeks, and then I'd be more inclined to then get started about 2 weeks post-op. This isn't sadly based on any research or anything. It's purely based on my anecdotal experience, because there is no research out there as to when the best time to get started with post-op physio in TTAs. So yeah, that would be my thing. Just because you need to allow that. The reason I say 2 weeks is because I want the callus of the callus is what we call the new bone, where they've broken the bone and then screwed it back on again. So they have fixed it, but you need to give it a little bit of time to consolidate and actually start turning back into bone again and mending that break before you then start doing the weight-bearing exercises and things that you would do immediately with a TPLO.
Okay, well, that's really interesting, because I guess, those of us who are very enthusiastic about physical therapy, there can be a danger, I guess, of being overly enthusiastic.
Indeed,
if you're not adequately informed, right? And this is why they're experts like you. But I don't know the nature of the discussion between Laura and her colleagues, so I don't know who was saying what.
Yeah.
I'm sure she'll let us know. But that's really interesting for me as well, because I think, if you're not informed, you can sort of have this assumption that in every case is just the same and you just get on with it, sort of thing. But that from what you just said is not correct. So.
No, not remotely. What you would do for one surgery is completely different from what you would do from another surgery, but it can be for the same illness. So it's you need to understand what's going on, basically.
Okay, well, fantastic. I've had another 15 minutes of learning, which is always good for me. So, Kim, thanks a lot. I hope you continue to improve, and we'll speak again hopefully in a couple of days.
Cool. That sounds good.
All right. Thank you.
All right. Bye-bye.
Cheers. Bye-bye.